When you're choking alone, you can't call for help. Every second counts, and no one is coming. A complete blockage seals the airway. No air moves in. No air moves out. Nothing gets through. You cannot speak. Speech needs airflow, and right now, that airflow simply does not exist. Without oxygen, consciousness fades fast. Within 1 minute, the brain begins shutting down.
Today, I'll teach you how to survive choking when you're completely alone.
Know the difference. Partial blockage still lets air through. Complete blockage lets nothing pass at all. If you can cough forcefully, the airway is only partly blocked. Your own cough is stronger than anything else available to you. So do not interfere with a cough that is working. No water, no slapping at yourself, no fingers in your mouth. Let it work. But if you cannot cough, cannot breathe, and cannot make any sound at all, the airway is completely blocked. Silence is the emergency. The dangerous choking makes no noise, and the countdown has already begun.
First, dial emergency services immediately. Put the call on speaker and leave the line open.
Make a fist and place the thumb side against the upper abdomen, just above the navel, below the ribs. Wrap your second hand tightly over the fist. This reinforced grip is what lets you deliver real, powerful force on your own. Now thrust hard, inward toward the spine, then sharply upward under the ribs. In and up, a single violent motion. That thrust drives the diaphragm up, compressing your lungs and forcing air upward to blast the obstruction free.
Repeat until it clears. There is no fixed number. Keep going until you can breathe again. If your hands can't generate enough force, use a chair. Find a sturdy, high-backed one nearby.
Lean forward, pressing the top edge of the chair just above your navel. Grip the sides firmly for support.
Drop your body weight sharply onto the chair edge. Use leverage and gravity to force the air upward. Repeat firmly.
For a pregnant woman, or anyone with a larger frame, shift your target upward to the center of the breastbone.
Place your fist on the center of the breastbone and thrust straight inward, repeatedly, with full force.
Never perform a blind finger sweep. You risk driving the object deeper into the narrowest part of the airway. And do not try to wash it down with water. A complete blockage cannot be flushed away. It only wastes time. Stay exactly where you are. Do not walk toward the door. If you collapse, you must remain within reach of help.
Afterward, always get examined. Thrusts can bruise or crack ribs, and food fragments may still remain in the airway. Normally, the epiglottis folds down over your airway as you swallow, guiding food safely past into the esophagus. With age, this timing degrades. Dentures, dry mouth, alcohol, talking while eating, and stroke all raise your risk.
A dry mouth is dangerous. Saliva binds food into a cohesive bolus. Without it, dry fragments scatter toward the airway. Prevent it. Cut food into small pieces. Sit fully upright, and avoid drinking alcohol before or during meals. If swallowing feels difficult, see a doctor about dysphagia. And practice these steps now, before you ever need them.